Hi, Dr. Elisha Van Dusen here with New Hope Chiropractic. Today I'm going to talk about some of the medical tests and preventive screenings you should be doing on a regular basis to avoid certain diseases and medical problems, because prevention really is the key to longevity. So in your 20s, early detection is vital in preventing, diagnosing, and surviving many types of cancers and other serious diseases. You should start regular checkups and several important tests in your 20s to catch danger signs early. So if you're a woman and a man in your 20s, melanoma can be a big thing, especially if you spend a lot of time in the sun or you live in some of the Sunbelt states that have many days of sunshine during the year. It's the leading form of cancer in adults ages 25 to 29, and it's the second most common cancer in young people ages 15 to 25. If you're a woman, HPV or human papillomavirus is a leading cause of cervical cancer. You should be checked for that. High cholesterol in both men and women at this stage can start as early as your 20s, especially if you have a bad diet. Breast cancer in women, young women with family history, are at an increasingly high risk. And if you're a man, testicular cancer occurs most often in men ages 20 to 39, so that's something to look out for. So tests are annual skin tests by a dermatologist to check for skin cancer, blood pressure tests at every doctor visit, also pelvic exam, pap smear annually, cholesterol test every 5 years is important. So these are some things you should look out for in your 20s. Now in your 30s, both men and women are at a greater risk for heart disease and type 2 diabetes after age 30. So 1 in 10 cancers is diagnosed in people ages 25 to 40. So some of the risks in your 30s, if you're a woman, are cervical cancer. It's the number one cause of cancer in women ages 30 to 40. Breast cancer, high family risk of breast cancer. This increases the incidence a lot under age 40. Type 2 diabetes is also a big thing. 18% of women over 30 have type 2 diabetes, especially with a bad diet, which is so prevalent in America these days, all over the world actually, but especially here. And men, type 2 diabetes, 20% of men over 30 have type 2 diabetes. Testicular cancer too accounts for 15% of cancers in men ages 30 to 40. We got melanoma again, 11% of cancers in men over 30 constitute this. And colorectal cancer, 10% of cancers in men 30 to 40 are colorectal cancer. And then we got heart disease. It's the number one killer of men over age 35. So some tests to do, pelvic exam and pap smear for women, breast exam annually for women, diagnostic ultrasound, thermography for women, especially good because you're not exposing the breasts to high levels of radiation. Blood sugar tests every 5 years, especially if you're overweight. It's good for both men and women. Annual testicular exam for men is important. Cholesterol testing every 5 years, and screenings for colorectal and prostate cancer if you're a man, especially if you're at high risk. So this is important too. And don't forget, properly functioning spine and nervous system is especially important for keeping all these areas healthy, because your nervous system really does control everything. For that, getting regular chiropractic checkups and adjustments is extremely important, at least once a month, to keep your spine and nervous system in optimum working condition. Visit us at newhopechiropractic.com and have yourself a healthy day.